evening. My name is Courtney, and I work with Congresswoman Robin Kelly. I'd like to welcome you to the Congresswoman's Coronavirus Telephone Town Hall. For those of you who are wondering if you're connected, you are. Right now, you're in what is called listen-only mode, which means that you can hear me, but I cannot hear you. In just a moment, I'll introduce Congresswoman Kelly, and then we'll open it up for questions. But first, let me go over a few housekeeping items. If you'd like to ask a question, it's very easy. At any time, you can press *3 on your phone, and you'll be put in line to speak with one of our staff members. They'll pop on and take down your name, where you're calling from, and your question, and then we'll try to get to you as quickly as possible. The next time you hear your name by either me or the Congresswoman, you'll be live to the entire conference, and you'll be able to ask your question directly to the Congresswoman or our expert. If we're unable to get to your question this evening, you'll have the opportunity to leave a voicemail at the end of the call, and we'll get back to you as quickly as possible. I know it sounds like a lot, but trust me, it's very simple. And if you have any questions, you can ask our staff while they're taking down your name. We'll be visiting for a while this evening, so there'll be time to take a number of questions. So please feel free to go ahead and press *3 now if you'd like to ask Congresswoman Kelly a question. Now, I'd like to turn the conversation over to Congresswoman Kelly. Congresswoman?
Thank you, Courtney, and good evening, 2nd District family. Over the past several weeks, our nation has been confronted with a serious and accelerating challenge. This challenge has tested the limits of our public health security, our community responses, our day-to-day ingenuity, and our everyday resolve. The coronavirus crisis has illuminated who we are as a people. For many, has put in perspective what should matter most and the limits we're willing to endure to protect our families and communities from the spread of this virus. This crisis has introduced us to new norms of social distancing, sheltering in place, distant learning, locking in, remaining vigilant and resourceful. In these times, this is just a small part of what we must do as Americans to weather this crisis. As your representative in Congress, I'm here to do my part to see that you and your loved ones make it through these times with the best resources, access, and options for positive health outcomes. It's my job, and I take this responsibility seriously. In Congress, I'm working with Democrats and Republicans to invest in science-based, whole-of-government responses to coronavirus that will keep you and your loved ones safe. I'm working to pass critical funding to protect the small businesses you work so hard to maintain, and we want you to maintain here in the 2nd District. I'm working to make sure our vulnerable seniors are quickly given access to the right testing and health infrastructure to keep them healthy and able to recover successfully should they be exposed to the virus. To date, we've passed 2 coronavirus emergency funding bills in Congress. The first one, the Coronavirus Preparedness and Response Supplemental, which provided $8.3 billion in emergency federal funding to help with this crisis. And the second, about 8 to 10 days ago, the Family First Coronavirus Response Act, which offers provisions for food security, paid sick leave, free testing, and expanded unemployment benefits during this time. And at present, and I'm sure you've heard about it on the news, the third stimulus package that will, among other things, work to boost unemployment insurance, strengthen a child and earned income tax credits, more help for small business, help with student debt burden and the GI Bill benefits, and also help hospitals so that they can serve everyone they need to serve and that their healthcare folks, doctors, nurses, and everyone involved will be protected. These are some of the things that we're working on in Congress, but the point of this call this evening was for me to hear from you. I want to hear your ideas, your concerns, and listen to how I can be the best advocate for our district during this crisis. In addition to the 200,000 2nd District families who have dialed into this call, I'm joined by public health experts and advocates from the nation, the state, and local levels of government. Joining us this evening are Dr. Gary Puckrin, President and CEO of the National Minority Quality Forum, Alan Spooner, President and CEO at Franciscan Health South Suburban, Pat Collier, Deputy Chief of Staff for Federal Affairs at the Office of the Illinois Governor J.B. Pritzker, who's doing a great job, and Dr. Ebony Hilton, MD of Goodstock Consulting. These experts have volunteered to take their time from their busy schedules to assist with your questions. I know folks on the line have plenty to chat about, so with that, I thank you, and I'll kick it back over to Courtney.
Thank you, Congresswoman. For those of you just joining us, if you'd like to ask Congresswoman Kelly and our experts a question, please press star 3. Congresswoman, we've got a number of questions right now about pre-existing conditions. Dr. Hilton, can you speak more on how the virus affects those with pre-existing conditions?
Hi. First of all, thank you all for having me here. As I said, my name is Dr. Emily Hilton. I'm a UVA anesthesiologist in critical care medicine. One of the things we know, we keep hearing that this is a disease or a virus that targets the elderly population, and with the caveat of those with pre-existing conditions. And so when we're talking about pre-existing conditions, we're talking about cardiovascular disease, so whether or not you have high blood pressure, whether or not you have diabetes, if you have chronic respiratory disease like COPD, asthma, chronic bronchitis. And just to give you a couple of data facts, I think it's important for people to understand the numbers when they're going into this. Americans, as far as cardiovascular disease, that is one of our most common diseases of the population, and it affects about 48% of all Americans. That's about 121 million of us. As far as diabetes, or those with pre-diabetic conditions, that's about 100 million Americans. If you have diabetes alone, that's about 30 million Americans, or about 10% of our population. Or those with chronic respiratory diseases, that's approximately 175 million Americans with COPD, and 1 in every 13 of us have some form of asthma, right? So these are the type of conditions when they're saying pre-existing conditions, the impact that this virus can have on those folks who are already having organs that are saying, I need a little bit of help, if that makes sense. So so those people are at particular risk, and we tell those people as much as possible, stay in your home. We already know if you are one of those that suffers with chronic respiratory infections, for instance, then we know that the addition of this virus would just prove to be too much for your body. So it's important that you do social distancing, and I would even stretch it to the point of saying to stay within your home as much as possible.
Thank you for that, Doctor. If you'd like to ask Congresswoman Kelly and our experts a question, please press star 3. Right now we've got Regina on the line with a question we'd like Pat Collier to answer. Good evening, Regina.
Yes.
Regina?
I am calling. I'm a self-employed barber, hairstylist, and salon owner. I'm just trying to make sure that my business is considered non-essential because I don't have any backup plan for income. If I'm not working, I'm not getting paid.
Pat Collier, do you mind taking that question for us? Thanks.
Sure. And thank you for your question. We are looking at a whole set of businesses and enterprises that would be exempt. Barbershops and beauty salons are those that are being considered. Right now, the EO has been written broadly to accommodate small business owners and those businesses who are in need of staying open. So those businesses right now are considered or can apply or can be considered exempt, but the state will retain the right to review the universe of businesses to make sure that we are also serving the public health need of helping to get ahead and stop the spread of this virus.
Thank you, Pat, for that. If you'd like to ask Congresswoman Kelly and our experts on the line a question, please press star 3. Congresswoman, right now we've got Tamika on the line with a question Dr. Hilton we'd like to direct your way. Good evening, Tamika.
Good evening. So it's probably a two-part question. First is that they're telling us to be quarantined in the houses, but if we have young adults that are considered millennials and their job is an essential job at a grocery store or packaging, do we quarantine ourselves from them when they're coming in and out the house? And can it be on their hands when they're going up and down our stairs? Like, Are we safe in our homes when these children are coming in and out the house?
All right, and it's nice to hear from you, for one. I know this can be a very trying time. I have a nephew who's 22 years old and also in and out of the house. One of the things that I cannot stress enough is that it depends on the individual case, for one. If you're a high-risk individual, for instance, again, if you're elderly, so we're saying any individuals that are over the age of 60 to 65 years old, we are saying you're at advanced age, and we want you to take a little bit more precaution and care. And if you have any pre-existing conditions, in particular cardiovascular disease, like I said, if there's any issues with your heart, if there's any issues with your lungs, if you have any issues with or have been told we have diabetes or we pre-diabetic, these conditions just put you at a slightly higher risk too. And so we want to make sure we're protecting you as much as possible. Now, what we know is that people have to go to work, and I completely empathize and sympathize with that. What we say, though, if that millennial is going in and out of the house to go to work, then trying to reduce as much spread as possible. We know that the coronavirus can live on plastic as well as stainless steel within your home for upwards of 3 days. So that means as soon as that millennial comes into the house, before they come into the house, if they can go ahead and wipe their hands with hand sanitizers, that's great. Squirt their hands with hand sanitizer, go into the house, immediately take off all their clothes, their shoes included, because they can be tracking things through the house, and take a shower. Put those clothing items immediately into the wash and try to reduce the spread as much as possible. Like I said, it's going to be more of a marathon than a sprint when it comes to this virus, meaning that we're going to have to be patient with ourselves and adapt to the way that life is going to change slightly. But I would never tell you not to see your child for weeks to months. What I will say, though, is take every precaution possible. And remember that not all people will necessarily show any signs and symptoms. They may not have a fever. They may not have a cough, right? But they can still carry the infection. 80% of those who get infected with this virus will have very mild kind of signs and symptoms, barely a fever, barely a cough. If anything, they just feel like they have a really crappy cold or a mild form of the flu. So they may feel bad, but they don't look like what we're seeing as far as when we think of really, really sick. So that being the case, even if your millennial child comes in the house and they look like they're okay, tell them, I need you, in order to protect me, I need you to wash your hands. I need you to go take a shower immediately. I need you to wash your clothes. I hope that helps.
Thank you, Dr. Hilton. If you'd like to ask Congresswoman Robin Kelly or our experts a question, please press *3. Right now, we've got Jaya on the line, and Alan Spooner, we'd like to direct her question your way. Good evening, Jaya.
Yeah, good evening. I'm 70 and my husband is 79, and he has major heart problem and chronic bronchitis. In fact, he was in the hospital. I had to call 911 at the end of February, and he came home after 4 days. I was wondering if something like that happens, will 911 respond to my call, or what is the situation now?
Hi, this is Alan Spooner. Absolutely, 911 in the communities here in the south suburbs should respond to your call, and you'll be cared for as normal in the emergency room. We are taking as many precautions as humanly possible to pre-screen folks coming in either through drive-through or coming from the EMS from the different municipalities to take temperatures and make sure we treat everyone as a potentially afflicted with the COVID-19 virus. That way, if you're not exhibiting any symptoms, it will be a pretty normal visit to the emergency room. But 911 should respond to your call and bring you to the hospital as soon as possible.
Thank you, Mr. Spooner. If you'd like to ask a question, please press *3. And Mr. Spooner, we've got Dolores on the line right now with a question we'd also like to direct your way. Good evening, Dolores.
Yes. I was asking if I needed to go for a test, where in the south suburbs can we go for a test?
Well, right now, we are following, and all the hospitals have been directed by the Illinois Department of Public Health to follow the Center of Disease Control guidelines for obtaining tests. That means people who are going to get tests are those who are exhibiting symptoms of respiratory distress. And then if you come to the emergency room, or even if you called into the emergency room, we'll direct you to appropriate place to get the test. If you come to the emergency room and you're exhibiting those symptoms, you'll get a test. But be mindful, if you don't have a fever or you're not exhibiting symptoms of respiratory distress, the chances are very unlikely that you will be getting the test. There are not tests out there as of yet that are just, to test the general population to give folks peace of mind.
Thank you, Mr. Spooner. If you'd like to ask a question, please press *3. Dr. Puckrin, your organization, the National Minority Quality Forum, has collected over 5 billion patient records, and you yourself have been analyzing healthcare data for over 20 years to help build sustainable, healthy communities. Dr. Puckrin, what can we do now to have the best health outcomes when we have a better handle on the disease?
Well, the challenge right now is that this is a new disease and we're learning about it. And I think a lot of the recommendations and guidance that have been offered on this call are really what need to be followed. One of the things that is important to remember here is that we will get smarter about this disease, and we'll learn how to control it. If you look at this disease compared to, say, the Spanish flu in 1918, the population didn't even know it was coming. Today, we have the ability to anticipate pandemics like this, where we're challenged is learning what to do with the information as it comes forward. So we're going to get smarter. This will be a really challenging period, but I think over the long haul, we'll be able to get control over a disease like this.
Thank you, Dr. Puckrin. If you'd like to ask Congresswoman Kelly and our experts a question, please press *3. Congresswoman Kelly, right now we've got Sandra on the line with a question we'd actually like to direct your way. Good evening, Sandra. You're live with Congresswoman Robin Kelly.
Good evening. Thank you for taking my call and my question. I'm concerned about unemployment. I'm hearing numbers like it's going to be 20%, and I hear a lot about, the bill is going to take care of the corporations and it may take care of some of the people. What is the bill going to do as far as unemployment for all of these people that are losing and will lose their jobs?
Well, we're working on that right now. As you know, people are applying for unemployment, and we're going to pump money into the state so they can take care of those people that are applying. And then also what we're looking at, and we're working on this bill right now, we're looking at actually sending money to individuals. It'll never be enough money, but sending money to individuals. And also the other thing is, even though some people are losing their jobs, there are people that are hiring also because of so much online, so much delivering and trucking and things like that also. So, but that's what we're looking at. People are losing their jobs, but they can go to apply for unemployment, and we're going to pump more money into the state to that so they can better handle it. And then compensation around sending money to individuals up to a certain amount of money coming into the household or no money coming into the household.
Thank you, Congresswoman.
Thank you.
Right now we've got